How do rare diseases work in med school pathology? Imagine trying to solve a puzzle with missing pieces. That's often what studying rare diseases feels like in medical school. These conditions are uncommon, but understanding them is key to becoming a well-rounded doctor. When you first start learning pathology in your second year, you cover the basics like cell injury, inflammation, and cancer. These core ideas help you see how diseases develop and affect the body. Rare diseases usually have a genetic or molecular cause, so they fit into lessons about DNA, genes, and how mutations can lead to illness. You might learn about inheritance patterns, like autosomal dominant or recessive, and how specific gene changes cause certain conditions. In your coursework, you also explore specialized tests like polymerase chain reaction, which amplifies DNA to find mutations, or cytogenetics, which looks at chromosomes for abnormalities. These tools are essential for diagnosing rare genetic disorders. Because these diseases are so uncommon, your curriculum might include elective modules focused on them. These modules highlight how important family history is and how genetic counseling can help families understand risks. You also learn that diagnosing rare diseases can be tricky because symptoms often overlap with more common conditions. That's why pathology labs play a big role. They help identify the exact mutation or abnormality causing the disease. During your first and second years, you mainly focus on understanding disease mechanisms, but you also get a glimpse of how rare diseases fit into the bigger picture. You learn that although each rare disease affects a small number of people, together they make up a significant part of medical practice. In residency, you get more hands-on experience with advanced diagnostics like in-situ hybridization, which detects specific DNA or RNA sequences in tissue samples. Rotations in subspecialties like hematopathology or dermopathology expose you to rare conditions more frequently. Practicing doctors and residents interpret complex genetic test results to confirm diagnoses. They also learn about the limitations. Sometimes tests aren't definitive, or symptoms are atypical. This is where clinical judgment and pathology reports work together to guide treatment. You also discover that research and clinical trials are vital for developing therapies for rare diseases, often called orphan diseases. These treatments can be very expensive and take years to develop, but they make a huge difference for patients. In the end, understanding how rare diseases work in pathology involves connecting basic science with clinical clues. It's about learning to recognize unusual patterns, interpret complex tests, and appreciate the importance of ongoing research. While you might not see many rare diseases in your first couple of years, the foundation you build now prepares you for more advanced training later. It's a fascinating part of medicine that reminds us how diverse and intricate the human body truly is.